Hi, this is Bill once again with my special guest, Dr. Craig Greene, who's going to focus on the shoulder joint. The reason I'm so excited about this segment is what Dr. Craig Greene is going to do is actually educate us on the basic terminology of the shoulder joint, what it means, how it affects us, and how you can help us out. One of the most common terms that I've heard throughout the years is shoulder separation. Take it from here, please.
Good question, Bill. And one of the important points that we think about as doctors and also as patients, this is an injury my brother has had as well, is what is a separated shoulder? The people it most often occurs to are athletes that fall directly on their shoulder, and there's a part of the shoulder bone, and then there's the collarbone, and as the collarbone separates from the shoulder bone, that's called a separated shoulder. It doesn't actually have anything to do with the actual ball and socket joint. How it affects you is it has no effect on how the actual shoulder joint is moving. Quarterbacks can have an AC joint separation and still throw the ball. There's several different types, and we only fix the extreme types when they're symptomatic. And that's what over time, if they're symptomatic, then we may have to do a reconstructive surgery for it.
Okay, our next common term, you hear it all the time, shoulder impingement. Now, again, what does it mean? What does the person experience? How can you help?
Very good questions, and it's a very common problem. And if you'll allow me here, I may borrow your hands as well. If the shoulder is a ball and a socket, and as the ball comes up in the socket, part of the acromion is overhanging, and the actual ball can impinge or hit that socket. Now, the rotator cuff muscle is coming out and attaching there, and that's what actually a common wastebasket sort of term that goes into impingement is subacromial bursitis, rotator cuff tendinitis, because that tendon and that bursa are getting caught underneath the acromion, and it's being impinged. Now, that is symptomatic in people with overhead activities, middle-aged men and women that paint or work on a shelf. It's very painful. What we do after they fail conservative measures, such as preventative measures, such as physical therapy, injections, we can go in there and trim off the undersurface of that and clean out the bursa with a surgery, if necessary, after failing conservative measures.
Now, rotator cuff. You mentioned the rotator cuff. Now, we've heard all kinds of expressions. Rotary cuff, rotator cuff, but rarely rotator cuff. But it's incredible how many people experience rotator cuff injuries. And maybe you can expand on that also, please.
That's another very good question, Bill. And the rotator cuff is a confluence of 4 muscles that become tendons and then attach on the shoulder, the top part of the shoulder bone, the proximal humerus. And what those do, they lift the shoulder up, and then you get an excessive amount of force there. When there's a tear in the rotator cuff, what happens is the rotator cuff loses its force coupling, and what that means is when the rotator cuff is intact, it holds it in place. When it's not intact, it's loose and symptomatic. A small rotator cuff tear will become a larger rotator cuff tear. There are a lot in the subpopulation of patients that try to tough it out. Oh, it's just my shoulder, I don't need to worry about it. No, you need to strengthen your shoulder muscles, your rotator cuff muscles, if it's not torn. And if it is torn, you need to come see a doctor so we can address that, because truly an ounce of prevention is worth a pound of cure.
Now, we have 1 minute left, Dr. Greene, and we're going to talk with Chris Purvis, our physical therapist, about the importance of balance training for the shoulder joint. So can you close this segment with a very important message for our viewers, how important balance training is?
Absolutely. The shoulder is attached to your trunk, which is part of your core. And core strengthening is a very hot topic right now, and I think it's appropriate, because if you can tighten your core and maintain good balance while maintaining and improving on your shoulder strength and your rotator cuff, I think it improves your overall core stability.
Thank you so much, Dr. Greene. It's a pleasure seeing you again.
Thank you for
having us. And we're looking forward to other segments dealing with physical medicine and injury prevention.